they're all where they can see and hear and interact. So, well, let's. This one's a. So, Laura, if you wouldn't mind muting everyone that's not panel, and give her a moment to do that. And yeah, I think we all pretty much know each other, but I'll invite each of the panelists to take a moment, introduce yourselves, and be sure to tell us your relevant credentials and expertise, and then also, how long you've been at First Central and why. So if we go in alphabetical order, that starts with John. So.
Hi. Well, I've been thinking today, this week, I guess, that I was in jail 57 years ago in Mississippi after my first hour in Mississippi. And well, I can talk about that later or not at all. And then returned to Mississippi in 1964 for a year and a half, working full time in the civil rights movement, registering voters. And
you worked with Bob Moses, right?
Yes. And Jim Foreman and a bunch of other people. And then came to Omaha and helped to create Greater Omaha Community Action, the first anti-poverty program here. And went out to UNO, where I was in social work and helped to create the College of Public Affairs Community Service and bring the School of Social Work from Lincoln to Omaha. And then went over to the University of Iowa, into Zambia for 6 months, and to Zimbabwe for 2.5 years. And then came back and started a nonprofit and did that for 15 years. Retired and came to Omaha 10 years ago and joined First Central almost 1.5 years ago now. And have felt really excited about its work and its services, especially, and the community. Thank you.
Steve, you want to go next?
Sure. I'm Steve Jackson. For those of you that I don't know who don't know me, I have a master's in public health from the University of Nebraska Med Center. I worked for DHHS for 26 years, first in HIV counseling and testing. We did education within the community, and I was assigned to West Central and Western Nebraska. It was pretty interesting being the person of color who went out there because, there weren't very many people of color out there. I didn't have any problems whatsoever. It was a great time. About 14 years ago, then I moved to the Ryan White program and provided care and treatment services to people living with HIV. We started the program with a budget of $2.3 million. And when I left in January, we had a budget of over $16 million. I am now working with Douglas County Juvenile Services Aid as a grant specialist. So going from public health now to juvenile services, it is interesting to see how all of this kind of works together with disparately impacted populations. I came to First Central as a guest of my significant other at the time, Scott Stilley, in 1989, and I joined shortly after that. And I've been a member because of the family atmosphere and the love and support that we received as a gay couple and interracial couple, and just as human beings. So I love First Central and I love the First Central family.
Well, and you also prepare taxes too. So.
Oh, yes, and I also work at the hardware store.
Yeah, you do a lot of things.
Yes.
And so Tracy.
So I am a business owner. In fact, I own two businesses, and part of my responsibility is to do strategic planning in those businesses. And 3 years ago, I think I turned to Deb Kerwin during an adult planning session, and I said, you know, I've started investigating this area that I think changed my whole outlook on everything that I do, about the fourth industrial revolution and the future of work, and aligning workforce development and education around how those changes are coming about. So I did an adult ed 3 years ago about the fourth industrial revolution and the future of work, and have continued to work in that area. And as a result, I was asked by the UN, or the publisher of the UN, to develop a guidebook for corporations on Sustainable Development Goal 4, which is about quality education and lifelong learning, which is at the publisher, yay. I know. God,
When is that coming out, or do you know?
but, it's supposed to be out later this month because we're speaking to an HR group about it, but candidly, unless you're really interested in corporate learning and development, it's really boring. I wouldn't necessarily recommend it, but I don't think it's boring, but anyway. I was actually born at First Central. I was baptized there, so the question really isn't how did I get to First Central. I had no. The question is, I think, why do I stay? And First Central has had a powerful impact on the way that I define and articulate, and also how I process its application to everyday life. Also, since I tend to be one of those people who is highly driven by intellect, my emotional response isn't always the best. So I greatly love and appreciate the grace that people at First Central extend to me.
You wouldn't want to read my dissertation either, so you know those.
Thank you. People say that a lot. Oh, I'd like to read it, and I say,
No.
nah,
I mean, so obviously, when we set up this forum, it was going to focus primarily on the pandemic and justice issues and economic issues and events have developed over the course of the last few weeks from between scheduling it and us actually getting to it. So I'm assuming our conversation today might be will definitely be a little different than what we maybe originally envisioned. So let me begin with a question that brought up just from the last few weeks. So all these racial justice issues that have come to the forefront of our consciousness in the last couple of weeks. Do you think that the pandemic and the quarantines have contributed to this situation any, and how might they have contributed, and how can we kind of relate these two crises that are both underway at the same time? So,
can I go, or?
Yeah, go ahead.
Go ahead, John. I don't think the pandemic has really influenced the issues themselves. The issues have been out there all along. I think what it may have influenced is the response. So when we say that, for example, African Americans are about 13% or 14% of the population of the U.S. in heavily African American counties, COVID cases, among all the COVID cases, 50% are among the African American communities. 60% of the deaths are among African Americans. The president made a big deal about unemployment going down last week. In fact, it went up in the African American community. So my thought is the issues are still there, and now they've just gotten worse. So.
And I would agree with Tracy, but from an African American perspective, anytime the larger Black community hears something about a pandemic or a virus or an epidemic, there's fear and distrust because of all of the things that have happened historically within the Black community, Black America. So the belief that it is factual and how it will impact us is frustrating and hard to parse and kind of work through all of those issues that arise with new information about diseases. So trust is always an issue. Access to anything that would help protect the community. The frustration is there with like, oh, I don't have masks. How do I get masks? I can't afford masks. Or even being able to order them online. Who has access to online services? Who can afford the online things? So the frustration mounts and it builds upon all of the stuff that currently exists in society for African Americans in certain situations. So I think those are some of the things. And as Tracy said, the responses then become a different issue of how the pandemic affects the community.
The organization that I formed had a contract with the Refugee Resettlement Program nationally, and we served about 30 agencies across the country. So I've had about 30 years of experience with refugee communities. In the last 2.5 years, I've been working intensely with the South Sudanese community, trying to help them get funding to have a full-time staff. And they have, in spite of the fact that we've gotten I think 5 or 6 grants. None of those have been large enough to allow us to employ somebody, and that creates a major problem. There are 15,000 South Sudanese in Omaha. I've been working almost full-time the last month with helping to actually doing the getting applications from South Sudanese people, and actually they've been getting through the churches and other sources and sending them to me. We've gotten only 36. Well, we've gotten 46 now, but 36 in the first application. We applied for 105,000 from Omaha Community Foundation, got 20,000. That allowed us to get about $500 per person, a little over $500 per person, only for rent assistance. There wasn't money for food nor for social service for food or utilities, but we were able to get some or the other, and that was tremendous help. Also, all of the people had agreed to apply for unemployment, but I went to the unemployment office because of the contact I have there. And within 2 hours, they gave me the list of everyone on my list that I sent them who had applied. And according to their records, only 2 of those 36 had applied. I know that many more tried to apply, but I think the difficulty of making that application, of doing that online, and of not getting a response was just frustrating as could be. And so I think there've been 6 to 8 weeks without income in families of 6 or 8, even up to 10 people. And I don't know how they can survive, but somehow they've managed to do that. Some of them are going back to work this week, have gone back to work this week. And I think others will probably go back to work next week, but it's just a devastating thing. And those are just a small group of community that I'm aware of. There are hundreds of South Sudanese unemployed. Most South Sudanese don't think that the system is going to help them at all, so they don't even make the application. We were lucky to get 36 or 46 now. And now they're starting to hear about it and do something. But it's a terrible situation that we don't hear much about. And I guess the biggest thing that the pandemic has done is made us aware of low wages of employment, of the lack of sick leave in most of these jobs, and the lack of any kind of benefits, and of the poor health conditions and the poor health insurance availability for most of the low-income populations. I think that's what part of those things have been what has really empowered these demonstrations that are going on now.
Well, that perfectly sets up what was the next question, which is the pandemic does seem to have brought to light all sorts of inequities in our economy. And many of us probably knew about them ahead of time, but they're very vivid and very acute at the moment. And John has already named some of those. But it's almost kind of dizzying, the number of issues that have suddenly become really apparent. So what issues are you kind of focused on? And what do you suggest that maybe we as a church collectively ought to be focused on, and maybe trying to put some attention and efforts to dealing with these inequities in the economy? So.
Well, as I think back to the colleagues and to some of the clients that I had in my HIV care work, there are a lot of individuals who are isolated, who don't have anyone to talk to, who may not have someone to take them to the grocery store. And I think back, this is another question that you have later, Scott, but I think back to the beginning of the epidemic when we had buddy systems, when there would be someone who would volunteer to go out to a person's home and help them shop or shop for them. I know that we have, DoorDash and things like that to help with food, but there are a lot of people who are isolated. And I think about the elderly African Americans who would like to go to grocery stores, but don't trust a stranger to come to their house and deliver groceries. Maybe there's a way that we can reach out and do something like that to help people who are homebound and don't have the access to call and order their groceries or drive to the store and pick up the groceries that have been made accessible. Those are great things. They may not be things that everyone can access.
Two things I would mention very specifically are universal access to health care. I just think that's indispensable. We got to find some way to do that, and that has to be a universal commitment. The other thing is, I think $15 an hour wage is just a minimum that people have to have in order to be able to survive, and a mandatory sick leave policy for every employee. Those things, it seems to me, are just have to be.
Again, I tend to take more of a macro view of the economy, and like they say, when you're a hammer, the whole world looks like a nail. I tend to think in economic terms and what's going on. I think this pandemic has shown a significant light on the failings of the market economy. It's unjust, unsustainable, unstable, and unhealthy. And we have been evolving away from it for a very long time, except now it's accelerated that evolution. No question. So what I care about, or what I think about, is the future of work is a thing. It's shorthand for where work is going. If you Google it, you'll see a lot of articles about the future of work. So John, you talk about people not being able to apply for unemployment. We're 30 million unemployed in this country right now. I think the number is really closer to 40 million based on how many people are unable to even apply. People in the gig economy, people who have been furloughed who aren't able to apply for unemployment. And then there are all those who are not in the labor force anymore. So the real number of people actually working and earning a living, their percentage among those who are able to, is only about 51%. And when you talk about recession versus depression is just a term that we can apply to how bad the economic situation gets. This rivals, obviously, the Great Depression. So, and companies have been evolving toward machine displacement of workers for a very long time. This has just accelerated that. You've already read about the companies who have gone ahead and laid off thousands of people. They just went ahead and did that. So what I care about in the future of work is who's going to benefit and who's going to be left behind.
One of the other things that John mentioned and Tracy touched on also is how do we address pandemic leave? So right now in our juvenile justice work, we're able to continue to pay the salaries of staff if the agency has an HR policy that addresses pandemic leave or some type of emergency leave that is beyond regular family medical leave. And as we can see with the packing plants and places like that, they don't have that. They don't have basic leave, as John and Tracy pointed out, but they don't have pandemic leave. And we don't have support from the country's administration to let those individuals stay home and be safe. Now, I've known at least 3 people in my extended family who refused to quit working and died because they came in contact with COVID and couldn't fight the virus itself, but they couldn't afford to stay home. They didn't see another way to survive but to continue working. And those 3 individuals have lost their lives because they didn't have emergency pandemic leave. Working for the county, if one of us gets sick, we don't have to worry about using our regular leave. We can get emergency family medical leave. And they've extended that. So that is a public policy. So I think that is one of the things that I think we should also be focused on, not necessarily at the church level, but at a larger level.
I know,
So,
I
go
noticed
ahead,
too. I noticed too that in Europe, they paid employers to pay the salaries of the workers during the pandemic. We didn't do that in the United States.
We did, John. That's what the PPP is. As a matter of fact, my company took advantage of that. And that's why they say employment rebounded.
I'm sorry?
Yeah, we have, that's the PPP program. My company took advantage of that, where you get paid, the SBA provided a loan equal to 18 months of your payroll for the past 18 months. And then it's a 1% loan that if you keep your people employed and pay out payroll, it's forgiven. That's why I think unemployment rebounded a little bit. We do have that program.
But we don't have that program. Europe didn't require employers to apply for something. That's what we did. The SBA, you had to apply to SBA, and that's a complicated process. In Europe, they paid the employers to keep the people employed.
well, besides these like inequities that have been revealed in this moment, and so we've got social unrest and pandemic and maybe a second Great Depression. What do you think are going to be the long-lasting economic and social effects of the economic depression? What are you kind of most worried about economically in both the short term and the long term? And you've already addressed a little bit of that, but ask that more specifically.
Look, the U.S. is is fueled by consumer spending. And the U.S. economy is fueled by consumer spending. If that doesn't rebound, then it'll be, I think McKinsey estimates that it'll be first quarter 2021, if there's not a second wave of the pandemic, that we reach 2019 levels. If there is a second wave and we don't get it under control, it'll be second quarter 2023. So My concern is, again, I mean, I hate to keep talking about this in a way, but I feel fairly passionate about it. If we don't recognize that the economy has shifted and we aren't addressing systemic changes in that economy, if we continue to believe that we can just take the economy back to 1950 and everything will be great, we will continue to have this huge disparity between very wealthy and all the rest of us, and it'll only get worse.
Agree. I do think that low-income people are used to surviving, and they'll find a way to survive. And that's discouraging and sad. I don't think we can expect things to change for them. I don't see our policymakers making significant changes, and that's really tragic.
And I sort of agree with John on this one. It's sad, it's depressing, and it's also
basic income.
kind of immobilizing to a point. How do we help those individuals? How do we help mobilize individuals who accept the way that things are, status quo? How do we ingrain in them that the protests and the social activities, advocacy is how they effect change? You're talking about individuals who have been beat down for so long and don't see a way out of poverty or don't see a way to make effective change in their lives by going to their congressman. One of the things that I'm doing from here to help in South Carolina is to push voter registration to get rid of Lindsey Graham. I was talking to Tracy about that last night. And then to do some more of that type of activism. How do we get rid of those people in Congress who don't do anything to help the people who are most affected by poverty, by the pandemic, Black and brown people, Asian Americans, who don't know that maybe they can affect change just beating people up at the ballot box. It doesn't have to be about violence. Doing your civic duties and voting is one way to get rid of some of those people who don't care and who haven't cared.
I heard Kathy say in the background something about universal basic income. Anybody want to talk about that Andrew Yang was running on that. It seemed kind of a strange idea. And then we hit this pandemic where millions of people aren't working, and suddenly it doesn't seem like such a strange idea. So
It's universal basic income has been around for a long time, and it's a natural suggestion coming out of this idea of the economic system shifts. If companies continue to make more money based on fewer employees, there's got to be someone who can buy their products, right? And you need an income to do that. So two of the thoughts about shifting from a market economy to what's called the well-being economy is either universal basic services, which include healthcare and education, and or universal income. And you're right, it was frustrating to me that Andrew Yang was the only one who seemed to even understand that that's been talked around the world for like well over a year. And it shocked me that on the debate stage, Elizabeth Warren was kind of surprised to even hear about it. The U.S. is not competitive in moving there compared to the rest of the world. The U.S. is way behind in understanding where this economy is going and preparing its people for it. Universal basic income is one solution. We have to get rid of these fallacies, myths that we love to cling to from the 20th century that if businesses do well, it'll trickle down to people. It doesn't, it never was true, and it's certainly not true now. And the other fallacy is that if people are given money, they'll be lazy and won't work. that's been disproven many times. So
One of my kind of concerns about the kind of larger economic issues, and this wasn't in the questions, but it kind of is the generational differences. So I'm finally happy to be Generation X because we're at middle age. We don't have to survive on our investments at the moment, and we also hopefully have enough saved up to kind of survive in this moment. But I worry about my mother, who's on the Zoom today, and folks who are retired who do have to survive on their pensions and their retirement, and worried then about millennials who have never recovered from the last recession and are entering middle age, uh, but don't have savings and don't have equity and are still paying off student debt, and that will be even more difficult for that. You know, it's kind of a toxic brew. It's not going to look good for like a whole generations of people for the next 20 or 30 years. So
I totally get the millennials' resentment of baby boomers. I mean, we are not leaving them a great world. So I think I'm hopeful about the way that they are now asserting their views. I hope they start voting, honestly.
Yes.
I didn't mention in the things that I think employers ought to be required to provide some kind of retirement system. I mean, people in packing houses have never heard of a retirement system. They don't get it offered, and there's no match if there were offered. But I think that should be a requirement. If people are employed, they should have the chance to save money, and part of their the employer ought to be putting money into it so that they have a retirement, even if it's not a great one, at least they have a retirement. The other thing is, I think our tax system really has to be changed. I mean, to have multi-billion-dollar companies not paying any taxes is unconscionable. And surely our legislators can, our Congress people and senators can pass something that has at least a minimum, even it's 15% or 20% minimum tax on their income or on their profits, or without all these incentives for them to write their expenses off from taxes.
Can you say complicit? I mean, if we look at our administration and how they're making money off of the economy, I mean, there's no incentive to do any of those things. I agree with you 100%, but there.
Yeah, the only thing I'll say about corporations being mandated to do that, and I agree corporations should do it, and in fact my company does it, but you know, as we evolve to a gig economy, to me it's just wrong that people need to stay employed to keep their health care. They need to stay employed to keep their retirement system, and it's unhinging from corporations more and more. So I don't think it should be the corporate responsibility, although I think corporate should do that. I think finally we have to decide, you know, is the government responsible for these universal services for all of our people, whether they're employed or not?
well, let's talk about healthcare specifically. That came up earlier, and I wanted to have a question that kind of focused on that. I think we've known that the healthcare system needed work for a long time, and we've tinkered around the edges at it, but particularly a pandemic has revealed the really serious cracks in the system about access and delivery and equity in that regard. So do you think that we'll get any sort of lasting reform because this has all been brought to light so vividly in this moment?
And Steve and I talked about this last night. I said, yeah, my first response to Scott's question about the healthcare system was, what system?
Mm.
We don't have a healthcare system unless you consider GoFundMe part of the system,
Oh, wow.
Steve.
Yeah, it was frustrating, and particularly from a tax perspective, um, looking at healthcare and how what people called Obamacare or healthcare.gov, it wasn't the best system in the world, but it provided health insurance for people who had never had health insurance. It took away people going to the emergency room as their general health practice, and we still have that. I was working with some of the HIV patients who did the exact same thing. Every time they got sick, they'd wait until it was almost devastating before they went to the emergency room, and my program couldn't pay for that. So they were stuck with those bills, and then the hospital will have to write it off, and then ensuing increases in costs for the rest of us when we go to the hospital is what the results were. So I was trying to work with that population to make them understand we can pay for your regular doctor visits. Find you a general practitioner, go in, we will pay the lab costs, we will pay your office visits, we will pay everything. And then you don't have this cost of the emergency room that you'll eventually have to pay out of pocket. Because if they're taken to collections can then garnish their wages and their accounts. And then they're calling and they're upset again. So at least with that healthcare system, we had people who were able to access care beyond what I was able to pay through my program for specific HIV/AIDS care. They could get care for all of the ancillary medical problems they had, whether it be cancer, pancreatic issues, heart issues, cardiac things. It was something that people were excited about. Some went out and purchased it on their own and then found out that we could help with that. But that was an example of how the system could be expanded beyond just one type of medical care. If we were taking care of a part of it, and we know Medicare doesn't take care of everything that a person needs. We were trying to expand it so that it covered dental care and anything that a person would need. So it wasn't, again, maybe the best system, but it gave us a system that we could have built upon to make it better. And there's really no support for it right now, and that's disheartening.
I remember, talking to you and other people who worked in HIV care delivery and stuff, like how transformative the Affordable Care Act was in finally achieving, some goals that have been worked on for like 30 years, and it just really did significantly improve HIV and AIDS care. And I don't think that story got told quite enough in the kind of larger narrative about the law. So
I also think that the pandemic has made us much more aware of how dangerous employer-related health health insurance is, because particularly with places like meatpacking plants, where most of the folks I'm working with are employed, they lose their health insurance, and that's been true across the country in all kinds of employment when they lose their job. So to lose one thing is to lose, the access to health care.
Yes. And even with retirement, I mean, working at the state, when I retired, I had 3 months where I didn't have health care. Luckily, as a veteran, I could go to the VA. So there was that safety net. But the cost to carry that health insurance for even those 3 months as I transitioned to another career was astronomical. Even with my, leave payout and whatnot, it would have been devastating to pay that cost out of my own pocket. And there has to be some other way that we can help individuals as they lose their jobs, as they retire, and even life insurance. Why couldn't there be some type of life insurance portability that I could have maintained that life insurance policy? There wasn't even an option. Maybe I couldn't have afforded it, but we don't have that option either. So we need to figure out a way that if there's a loss of a job, that the health insurance is affordable, that we can do that portability and maintain it ourselves.
Well, I remember almost 20 years ago, some congressional hearing where the CEOs of many of the largest corporations went up to Congress and said, please remove this burden from us because we don't want to be healthcare managers, and it makes us not competitive with other corporations in the world who don't have to do this. So it's not just that a workers' rights issue. It seems that corporations themselves would prefer not to have that responsibility. What do you think, Tracy? Is it?
Well, I don't know. I was reflecting on the question this week, and I thought there are a lot of issues with corporations and what they do, but if we talk about universal services being accessible to all, regardless of where they work or whether they work, the two key ones are education and healthcare. And frankly, I think corporations do a lot better job of providing funding for both of those than the government does. You know, I work with companies that have very generous tuition assistance programs for all their people. Companies that have very generous healthcare programs that include EAP that people are accessing now when their, sense of psychological well-being is just so. Unless we, I don't know that companies necessarily don't want to do it. Most companies I know realize that for their workers to be productive, they need to not be stressed about their health or their family's health or their long-term. So they accept that responsibility. More my concern is that a bigger portion of our workforce will, increasingly be not employed by a corporation. Mm-hmm. And frankly, when the pandemic shows that if people get sick, it affects the entire population, right? So it doesn't make any difference what neighborhood they live in or whether they are documented or not. They still get sick. It still has impacts in the corporation or the community, and the community only benefits from a well-being type of approach.
That brings up something that I thought of earlier, Tracy, and I think this is again one of those questions that we'll get to, but the way that the pandemic impacted the entire population. One, put a focus on public health and what public health is. It should be about prevention of the spread of disease. It also showed that divisions of wealth and access don't matter when it comes to a public health pandemic. People now know what public health is. People now know that contact tracing is a thing. Contact tracing has been a thing since the 1940s when the syphilis outbreak with World War II. But no one paid any attention to it because it didn't impact the upper echelons of society, the upper class folks with money in their pockets. But now, because the pandemic is impacting grandmothers and grandfathers and lawyers and doctors and nurses and congressmen, and we are doing contact tracing, it becomes an issue. People are like, I don't want them in my business. That's my private life. They shouldn't be asking me questions about who I was in contact with. But that's what public health is. That's what contact tracing is, and it is to protect the rest of society. Public health protects all of society, not just the poor indigent folks that get STDs or whatnot.
Well, I've got some kind of individual questions for each of the panelists that kind of play to their strengths and experience, and got these in kind of in alphabetical order. So first to John, who's talked already a little bit about some of this, but I'm sure has more to expand on it. He's been working with our refugee family, and then, as he said, with lots of South Sudanese refugees. And He also has this global experience. And so I thought I'd direct to him, how has our refugee family been impacted? I think people here would like to hear that. And then how is the refugee community affected? And then from your kind of perspective working in global development, how do you see kind of the global issues here? So however you want to take all of that.
Well, first of all, our refugee family has been fairly immune from it. I can't remember his name. The father. What's that? Mobark. Mobark was unemployed for part of it, but he's gotten back employed in a plastics industry, and he enjoys it. And Hawa has stayed at home most of the time. Of course, she's pregnant, and we can't figure out whether it's July or August that she's due, but she seems to be doing well. Kathy's taken her to her appointments each month, and she seems to be doing well. So our family is in good shape. I think refugees generally in the Omaha area are in tragic situation, just really unbelievably tragic. 6 or 8 weeks without income. They're probably in June going to get kicked out of their apartments or foreclosed on their houses because they haven't been able to pay rent or mortgages. And in June, they're allowed to be evicted and foreclosed on. And this month is going to be a terrible month for them. Worldwide, I think Europe has handled this very well. Australia and New Zealand have handled it wonderfully, especially New Zealand. And a couple of countries in Europe have had almost no effect because they really clamped down real hard very early. And they're now evidently fairly stable. African countries have clamped down really hard early. I think, like I found in South Sudan, I think they only had 10 cases, but they have been in lockdown for 3 months. It's still in lockdown. The chair of our board is in South Sudan. He's locked down in the hotel. And the only way he can get home is to pay $5,000 to the US government to pay for his price on an airfare to come home. And otherwise, to come home on his normal ticket, he has to wait for the airline to fly again. I was supposed to go to Uganda next month. The airline has canceled that flight, and I had planned not to go anyhow because Uganda has been heavily hit. I think African countries and developing countries generally have been very hard hit, and their health systems aren't ready for it. And I don't know how that's going to come out. We aren't hearing a lot about that. Oh, what was the other part of this?
I think you got all of it. So
Okay.
that was a lot of. Either the other two, if you want to comment on any of that John talked about. So, okay, Steve, you've spent decades in public health, particularly HIV/AIDS pandemic work, and so how's this current situation compare with that pandemic, and what lessons have you learned over all the years in that work that might apply now?
Well, this is a very similar instance as to the beginning of HIV. People were afraid to talk to each other, afraid to be around each other, touch each other. I think, and I've compared the two pandemics from the beginning, but I think what's happened now is that it's easier to protect yourself. What happened with the HIV epidemic is that it started supposedly in gay populations and Haitians and injecting drug users. This pandemic has hit all facets of the community, which is different and which has gotten much more publicity and much more notice, and it's been handled differently. I think the CDC has learned quite a few lessons from many of the pandemics that have happened since the HIV pandemic occurred, so are able to issue much more comprehensive and focused guidelines, and we're able to follow those. If we listen to local government instead of national government, we're much better off. And for quite a while, I was impressed with the way that Douglas County was handling things and the low number of impact cases that we had in Douglas County until we began to loosen some of the restrictions and cases began to climb. We're still doing much better than Iowa, of course, and some of the other states. There is still stigma involved, which I don't understand, but I guess that's just the nature of any type of virus or flu or pandemic. One of my neighbors across the street was impacted. She's a teacher at South High. Well, she has 2 roommates, and they didn't tell any of us that she had it. And when the roommate finally said something, she said, well, it was so embarrassing. I didn't want to tell anyone. It was like telling someone I had an STD. And that struck me as weird because, I mean, it's not something that should be stigmatized. It just is. It's just the way people are. The other piece is that with the HIV pandemic and the way we dealt with it in Nebraska or in the US is you had a group of individuals who rallied around those individuals who were infected and impacted and supported them. Again, went to buy groceries, took them shopping or to a movie, or relieved family members who were caregivers. That hasn't happened necessarily with this pandemic. So I think there's still a fear about transmission. We don't know as much as we knew about HIV. People still have that idea of invincibility. Well, it doesn't happen to young people, so I don't have to wear a mask, or I don't have to quarantine, or I don't have to stay away from 20 or so of my friends if I want to have a house party or a barbecue. I think that's going to happen no matter what is going on. It's just frightening, but it's also it's just been really interesting to see the parallels in the 2 pandemics.
Steve, I'd like to comment on your comment about the stigma of getting the disease. And it seems to me that a large portion of that has to do with it's predominantly low income, if on the whole population at least. I mean, it's everybody gets it, but the predominant number are low income people, and particularly people in close working relationships like in meatpacking plants, which makes them so subject to it. And I think and because of their poor health access, for both of those reasons, they are the ones that are getting it more often. And I think that's part of the stigma of it.
I agree, John. And I agree that with immigrant populations, I don't think the CDC or local governments have done enough to translate the information to different languages. When we have so many different languages and dialects, how do we get that information out to individuals? You know, the stigma that I kind of talked about, for me, I'm speaking from my experience, so maybe that wasn't the best way to phrase that, but thank you for that.
Steve, remember way back in February, which seems like an age ago now, when this started and there was a rumor going around that African Americans could not catch COVID? Remember
Yes.
that? Was that,
Yes, it was.
what was that all about? Was that related to this trust issue that you talk about?
No, for some reason, I don't know where this rumor originated, but the melanoma in African American skin was a protective factor, supposedly. And I have no idea where that came from or why that even made sense to people. But that was part of the myth. And what I've been trying to do, and I didn't talk about this earlier, Scott, was trying to dispel myths because someone made a comment uh, at one of the county board meetings about the Black Facebook. And it's not the Black Facebook, it's just people passing around information within the Black community, within their Facebook friends. But there was one rumor that said all you had to do if you got it was to use a blow dryer and blow hot air up your nose and it would get
Oh my
rid of
God.
the. And I like, you're going to kill yourself. You're going to do some damage to yourself by doing this. I can't remember some of the others, but they're just things that don't make sense if you think about it rationally. But
Injecting disinfectant, would that
Yeah.
be one?
not,
Well, before we leave this HIV question, there's one thing I want to. So I've read a few articles about how there is going to be some behavior that particularly we as gay men learned that might be useful for the whole rest of the culture now going forward. One
yes,
was we learned that we needed to be regularly and frequently tested.
yes,
So we needed to know our status. We needed to know whether we were positive or negative. And then we had to learn how to talk about that. You know, we had to surrender some privacy, and we had to be able to, um, share intimate details with people. And so there's some, so there's, as people kind of go forward and they're going to have to be calculating their own risks and their own exposure levels and stuff like that, I think it's going to require people being more, explicit. And so, and a good example for me this week was Sebastian returned to in-person piano lessons. But I, of course, emailed his piano teacher ahead of time and said, here's what I've done this week. My exposure levels are higher than what they have been. I need to inform you about that. Do you want to go ahead and still have that lesson? It's, et cetera. And I think it's just going to require us to make this just a kind of a pattern of our behavior before we interact with people. We're going to have to tell them more of, what we've done and stuff. Do you see that parallel, Steve?
I do, Scott. Yeah, that's a good point. And I didn't think about that. But if we think about how anytime we have any interaction with medical professionals, they're asking us all of these questions. Have you traveled? Have you, had a cough or a scratchy throat? Have you run a fever? They take your fever before you go into a building. I had a dental appointment for a cleaning. They met me in the vestibule outside and they asked all of these questions. It is very similar to screening for HIV or just even a general practice screening. Have you had unprotected sex? And if you have, with whom and how frequently, or when was the last exposure? Those are the type of questions that I would ask people. And now I'm on the other side getting those same questions. What are your exposures? But also, just as you said, being a little more upfront and loosening some of your personal protective information and saying, hey, I have not traveled, I've not had a cough, I've not had a fever, I test myself, I do my fever checks just to be sure for my safety and my family's safety. But yeah, I think that's the other piece of what the general population didn't have to deal with, Scott.
Maybe kind of like pre and post 9/11 and how we now are, the way we travel has changed airline travel totally. Last week I woke up with pink eye, so I raced out to my brother-in-law's clinic, which is, to me, is like going to Lincoln. Told them I wanted a COVID test because it's supposedly essential, and raced home to make a 9 o'clock Zoom meeting in my life, and got stopped by a patrolman with a speeding ticket. And I told them, hey, I just had a COVID test, so I put on my mask and I talked to him. 3 days later, I keep getting called by the state patrol, and I'm thinking it's just one of these guys trying to raise money, right? One of those scams. So I keep hanging up at him. Finally, he leaves a message and he said, you were stopped by one of our patrolmen and you said that you had had a COVID test and we need to know what the results were. So he was trying to do contact tracing. I felt kind of bad that I hung up on him.
Yeah, but I mean, I think that's the part of the issue with this. We are noticing across the nation the need for contact tracers. We are getting a lot of people who are coming out of retirement in public health to do contact tracing. Some are volunteering, some are being hired temporarily, and some are doing consulting work. But there's a need for over 100,000 contact tracers. But yeah, and people hang up on you all the time. People cuss you out because they don't want you in their business. It's not an easy thing to do. So I'm pretty sure, Tracy, that they expected maybe a while before they got in touch with you.
Well, Tracy, now to direct to you, and you've discussed already some of these issues. So it's, take this as open-ended as you want to talk about, the things that are important and that you're passionate about. But we do know that you've spent a lot of time thinking about the changing nature of employment, the changing nature of the economy that was going on well before any of this started. So how do you think this moment's going to change work in this country? And then how does education and training need to change in order to meet what our current and future needs are?
Yeah. So again, the future of work is shorthand for all of these impacts that are coming about as a result of the fourth industrial revolution. And the pandemic has only accelerated those impacts. And I think, I've always looked at education as a key, if not the key to opportunity. I see it as the means to succeeding or fulfillment, all of the above. It's interesting, about a year ago, the same week, I was talking to someone in Singapore and someone in India and someone in South Africa, and they all said the same thing to me, and that is our schools just don't do a good job of preparing the workforce for what we need. And it kind of paralleled the study that I saw that learning and development directors in companies said, very small numbers said universities and colleges don't do a good job of preparing the workforce, where chief academic officers in the universities, like 90%, said, yeah, we do a great job with that. So there's a disconnect there, and that disconnect is only going to widen as these skills evolve. What I see is, it used to be in the old days, like 3 years ago, companies would hire for technical skills and they train for soft skills, right? Now they hire for soft skills and train for technical skills, because the shelf life of those technical skills is only, 3 years? So that's evolving very quickly. The other thing that I've learned working on this book is that you really need these foundational skills to even participate in the job market today. They're literacy, numeracy, and digital literacy. And if you don't have those 3 skills, you're just going to have a very difficult time earning a sustainable living, no matter where you live in the world. I don't know. I mean, India's done a really great job of addressing the need for some of this upskilling and reskilling. Singapore's done a great job of it. Singapore offers free adult education for everyone in their population. South Africa has a fourth industrial revolution representative on there advising the president and how they need to evolve. And it makes me sad that it seems like people in Washington have yet to even acknowledge that this is going on, let alone put into place some of the programs that we need to be competitive with the world. So I'll end my rant there.
Steve or John, anyone want to comment on any of that? Or
I think it's positive. Very good.
Yes.
You know, the one thing I'll try to say that I think is positive, I had the opportunity to listen to Heather McGowan last week. She is like a leading thinker worldwide on the future of work. And Heather is, Tom Friedman quotes her all the time. Heather is optimistic about this moment in time, and so are a lot of progressive economists, because they see it as an opportunity now to evolve to a more sustainable and more just economic system. And, you know, could be.
we did get the New Deal out of the Great Depression, so.
Yeah. One of the things that
I'm just going to say, and I don't want to get too political, but in those days, in that time, we had a leader who was willing and able to take the lead and direct us around solutions that were equitable for everyone.
So, yeah, and I think that we're going to have to look to local leadership in order to make some move so that the administration at the upper levels can do some things. What I've noticed and what I've thought about as far as work goes is that more and more companies have realized that work at home or telecommuting is actually a functional part of the future work environment. For so long, people were reluctant to allow individuals to work at home because they wouldn't have immediate control over someone. They didn't know how productivity would work. But within county government, I'm hearing from some of the managers in the Douglas County Assessor's Office that people are more productive, that they're working at home, that is actually working out better. They don't have to provide as much office space as they used to. So that could be beneficial for us, because I know at the state, when I worked at the state, they would come up with a policy that says, yes, you can request to work from home, but you have to be in the office 1 day a week. Or then they'd switch it and say, no more working from home. So I think this is making some companies and some corporations see that, yes, telecommuting is a viable option and it can be conducive to productivity.
I just hope it remains something somewhat voluntary instead of imposed too, because some people don't like working from home, or it's not easy. And then of course, this particular situation has also raised, the issues of trying to work from home and do childcare or homeschooling. And that, as Katie Miller has pointed out, like, this is really the first time in human history that if people were quarantined at home, they were expected to still do their full-time jobs and their full-time childcare, because either, in the past, you wouldn't have had to try to do both. So it has been as we've talked before, the experiences of this time at home have been very different for different people. And, parents with young kids at home, it's been its own unique sort of struggle. And
McKinsey's got a great map of that for the U.S. about what percentage of the workforce has young people at home, state by state, because, look, we've got to open the economy. We've got to open the economy just because we've got to get it moving again. But it's unlikely that'll happen until we have a vaccine. Because even if you mandate that people go out, there's still going to be people who just won't. We've got to have school again so that parents can feel okay about their kids going to school. There are just a lot of things that need to happen. And just to say, oh, yeah, I'm going to open the economy again without taking into account those things that are stopping people is crazy.
Yvette wrote in the comments that her company's productivity has increased 25% while people have been working from home. So,
wow.
Yeah.
Well, for our work from home situation, we were told from the county that we would need to go work at home after there was the exposure in the county attorney's office. But what I found out was that we weren't required to work from home. And it's been relatively easy for me for the past 2 months to go into the office. There's no one else in there. I'm able to be productive. I'm not exposed to anyone, and I'm not exposing anyone at all. So I was able to go into the office, and although I love my spouse dearly, when he's done working, he wants to say, let's go outside and work in the yard, and let's go do this and let's go do that. And it's not conducive to me working. So I've been lucky that way, but even being able to work at home was beneficial. I think maybe because it's a new job, well, I'm getting off track. Never mind.
Okay. Well, I'm going to try to move to opening up to everybody else. So let me kind of skip ahead to my last two questions. I'll ask them together and let you kind of. So what actually inspires you the most right now? So let's try to think of, something positive. And then also, and I've asked this at the end of every one of these to all the panelists, what do you think is important for the church to be doing right now? So why don't you answer those questions, and then we'll open it up to everybody else. So.
Wow.
What inspires me right now, John? You can go ahead.
You're what, Steve?
Oh, you can go ahead.
No, go ahead.
Okay. What is inspiring me right now is the peaceful protest. George Floyd isn't the first African-American man who's been brutally murdered by the police. It's frustrating to me because I fit the profile of each of the Black men who have been killed. And that's been a really tough thing to see and to deal with on a regular basis. It's inspiring to see comments by people that I know and people that I don't know who are understanding that the basic privilege is the color of one's skin. That maybe because people of all races and colors have been subject to police brutality, that what one guy said to me yesterday was that when I see a police cruiser with its lights on in my rearview mirror, I probably know what I've done. Whereas if you, Steve, see this, you don't know why you're being stopped and you don't know what the outcome will be. So the protest and the fact that people are finally understanding what Black Lives Matter and why Colin Kaepernick knelt during the singing of the national anthem. It wasn't about the flag. It never was about the flag. It was about the murder of Black men and Black women. So that is making me feel good that we're seeing a lot of young people protesting, and over 60% or almost 50% of the protesters being white. So even though we have to go through this again, it's good to see that the protest is making a difference and helping people understand that every life matters, but what do you have to go through that is different than what I have to go through?
What do you think the church should be focused on doing right now? Part two of the question.
I think that the church should participate in the Black Lives Matter and do some education with the youth. We don't have a lot of Black kids in the congregation. How do we introduce kids to Black youth and to Black history? We don't have any Black history in schools. And then when in college it is elective, there are some amazing things that Black Americans have contributed to society, but do we talk about those types of things? Everybody knows what Thomas Edison did, but does everyone know what George Washington Carver contributed to society? So I think those are some of the things that we can do at a very basic level to let people know that Black Americans, one, are American and have contributed greatly to American society.
Fortunately, I grew up not far from the George Washington Carver birth site, so I do know what George Washington Carver contributed. John or Tracy, who wants to go next?
Well, I would say I agree with Steve that the demonstrations have been the most inspiring thing. I just hope they last and don't do like many of the civil rights and Vietnam and other ones did and get burned out, and or the gun rights issues recently. It's easy for us to lose that enthusiasm. So I don't know what we do to keep it alive, but we need to do that. Regarding the church, I think our congregation has done a terrific job in direct relief for people in various ways. I do not think that we've done nearly enough in terms of policy issues and in terms of financial assistance to policy organizations and to national and international relief and development organizations. And I think we need to put much more focus on that, including our church-related organizations. But I don't think we. I had a brother-in-law who died a couple years ago, who wrote a book about stewardship and taught at a seminary. And he took three congregations to 50-50 giving, 50% outside the church and for 50% of their own expenses. And that's a wonderful goal. I think it's virtually unachievable for most congregations, but I think it's a goal that we need to look at and try to set for ourselves.
Tracy, what inspires you? What should we be doing?
And what inspired me is much what Steve and John have already said. It inspires me to see these protests. It inspires me to see them worldwide. I'm inspired that there are white people in these protests as well, and there are so many young people. To me, that just indicates widespread response. Like John, I don't know that I hope that goes on. I hope that it results in real change, certainly, and that we're able to do something about that. So we shall see. I think change has to come at the ballot box, and change has to come through community pressure as well. I know the church is limited in what we can do with that. I do think that, gosh, it seems overwhelming. There's so many areas where we could give money, time, talent, all that kind of stuff. But given that our resources aren't unlimited, I think it would be really good to focus in on areas where we can actually make a difference. And I like what we're doing with the refugee families. It's one-on-one, it's personal. It appears to be making a difference in people's lives, and then if we can grow from there, that might be one way that we can really impact. I think we tried to have the other thing I like is the way lately I've heard people talk about white privilege, and it helped me understand why people resent that term, because I've heard them say, well, why do you talk about white privilege? I never got anything growing up. I grew up in poverty. I never was privileged. And it helped me understand the resentment against that and reframing that discussion around, look, you're privileged because you can go jogging without being afraid for your life. You can get stopped by a policeman without being afraid for your life. And I think if we reframe that discussion and help other people understand that, I get really distraught when I see some of the comments on Facebook from people that I even really know and love that demonstrate to me that they just really don't get it. And that's disturbing to me. I'm thinking about going off Facebook because I think Facebook is doing a really bad job of countering. I guess a lot of the posts about you need to go back to work, you need to open up the economy, you need to go out, are placed by thoughts. So, you know, Facebook just isn't doing a good job with that.
And, you know, on that, you know, that our next one of these will be in 2 weeks. And instead of a panel, it'll just be Tracy's son, Zach, talking to us about the technology issues that are and how they intersect with the pandemic. And it's not a panel because we have this one person who's in our extended family who, you know, functions at a very high level in the tech industry. So we're going to just kind of interview him and have some questions. And then in July, we have one planning to talk about the impacts on education. Now, less probably so on some of the issues that Tracy's brought up and more on, you know, education at our kind of local level and, you know, what parents and all have encountered and might be expecting for the next school year. But so who has questions at this point that they'd like to?
Can I just raise a little issue about that though?
Sure.
So we've done, this is all pre-COVID, so I don't know how it is now, but worldwide we've done really well at participation in education, especially elementary and secondary school. The numbers are really great in terms of access and participation, except for pockets like sub-Saharan Africa and rural areas. But the shocking thing is there are like 346 million kids in the world who can't form a simple sentence and can't do a simple math equation. So literacy and numeracy they can't do. And the shocking thing is 2/3 of those are in school.
Mm.
Okay.
I have one more question, one more point before we move on. The CARES Act funding that the county gets, $166 million. John can go to your organization and to help individuals meet some of their needs. And we need to, as a church, spread the word that we can go to the county commissioners and ask them for information about where those funds go, or put in an application for some of those funds. We need to spread the word that the Board of Commissioners meetings are open to the public and that people can go there, listen and participate, ask questions and make requests. I don't think we do enough.
Yvette, you unmuted a minute ago. Did you have a question you wanted to ask? Or no?
No.
Anybody else?
Allison, did your cat step on the keyboard?
No, I'm trying to clean out under some keys and apparently.
Scott, is it okay if I remind people that tomorrow at 2:00 in the afternoon, Peg Peterson and Brad Milton are going to be joining us for a Zoom session for First Forum Adult Ed to tell us about their experiences with the pandemic in Germany, where they're living now, and also to comment on what they see as the German reaction to the troubles we've been having over here lately. I guess whether you say yes or no, I've already done it.
And of course, that's okay. It's always better to ask forgiveness than permission. So
Exactly.
That's 2:00 tomorrow or today?
Tomorrow, 2:00 tomorrow, and the link it's the same link that we've been using for Adult Ed for First Forum all along, and it's been put out several times. But if you can't find it, just email me today, and I will email it to you.
okay, well, thanks everybody for being on. If no one has any other
Thank you.
questions, and thanks to our panelists again for contributing your thoughts and insights. And
Thank you.
Yes.
And we will see people tomorrow in various capacities. So
Sounds
Take
good.
care.
All right.
Thank you.
Take care, everyone.